Vipul, how's it
Hey
going?
there. How about you?
I'm doing great too. So nice to see you after a long, long time, man.
I know 2020 has been that kind of year, so
Right? All right. So, Vipul, tell us what made you move to the US? How did it all start?
uh, I think it was a very hard decision. But I think for me personally, I felt dentistry in India was awesome, but I just felt like it was a lot more didactic. There's a lot of like I felt like we did a lot of we know a lot, like we read a lot of books in India. So dentistry, the way we're trained as dental students in India is very different. So I just felt like we had a lot of the back end, as in the theory, the didactic part or something, as opposed to the hands-on and or clinical skills to match it. At least when you just graduate from dental school. So I'm not sure if it's still the same, but I know like everybody's drastically different. Knowing myself, I was like very bad with my actual handwork back in the day. So I really wanted programs that are a lot more clinical, a lot more didactic, where we would be actually. I mean, I can read pages and pages on how to do a root canal or a crown, but like actually doing it is a
It's
whole
a
different
different
story.
story, right?
I write 10 pages about it. Oh, this you should have a chamfer margin. You should have a shoulder, but actually doing it in person is it's like a very different ball game. So I felt like that was one. I spoke to a lot of people who went to school here, and I felt like a lot of them did like the fact that these programs in the U.S. at least are a lot more hands on. So like you cut 100 crowns, or it's all repetition, right after a point. So it's just that was something which interested me. That was one of the big reasons I said, hey, if I got to improve my clinical game, I got to go to a place where they would train me that way. So that was my thinking behind it.
Right. So, and that's the reason why you chose the DDS course, right?
That's
Correct. So, before applying for your DDS programs, the Advanced Standing International Dentist DDS programs, did you have to go for any special exams apart from your NBDE or the national boards?
Yeah, I mean, apart from the national boards, I think any international applicant has to do something called a TOEFL.
Right. Yeah.
So I mean, we got to prove that we know to speak English.
Right.
So that was the first step, and that's probably one of the easiest things. But that was one which I would encourage applicants to take it early. I mean, no, don't take it too early, because those scores like expire after 2 years. It's funny because you forget to read, write, speak English after 2 years, and so you got to take it. TOEFL was one of the exams, national boards. Certain schools needed a DAT, which dental admissions test, which is taken by a lot of American students who are actually not international but trained in America, and like go to college in America and then apply.
And recently, many schools have been started asking for DATs even from international students. So we definitely would like to know a little bit more about that. How did you prepare for that?
I mean, to be very honest, my preparation was a lot more for the national boards as opposed to the DATs, because only one school needed it. And they kind of understood that it's not, because we were already internationally trained dentists, so they didn't really want to test their aptitude for dentistry, because by that point that was
already established, right?
Correct. But I think for the DAT, they have something called, I think they got a section on math, which is very easy. I would say like anybody who's gone to school and knows basic math should be able to. It's not hard at all. Math is the easy. Correct. It was very easy. I wouldn't focus on math because you already got it. Whoever's taking it, definitely take a few practice tests. I don't know if Kaplan has a few practice tests, but most of these tests they've got preparatory materials. So I would just, if you Google like DAT prep material, you'll get tons of stuff. I mean, nowadays folks who post it on social media too. So there's, I don't know, there might be Facebook groups, there might be other groups where like there's a lot of other international applicants who are applying for a dental program. So I would just recommend getting access to one of those. Yeah, and it's one of the things about test taking in America, which is awesome, is it's pretty much, there's a very defined syllabus as opposed to taking tests in India, where there's really no, I mean, you could be asked questions from anywhere. So if they teach you ABC, they're going to ask you ABC. So it's just pretty much following that format, taking a few practice tests. But I would say, like, don't stress out about it. To anybody who's applying, that's the least of your problems.
Right. Perfect.
They have there is a section on the DAT called the perceptual ability test, which is a little tricky. So if you have to actually focus on something, I would recommend focusing on that part. Again, if it's there in your practice test, so it's something which basically if they want to test your ability to perceive certain geometrical shapes and figures and all of that. So they might want to ask, if things like, if this is a particular object and it has to fit in this particular thing, they would say, hey, how is it best? It's basically, let me put it this way to make it seem simple. It's just, if you think about a lock and key, right? If there's a key for a certain lock, they would essentially want you to
that way and no
yeah.
other way.
So they would give you a bunch of shapes and see which it's like a puzzle. So if you get with that sort of stuff, I mean, again, there's nothing to do with dentistry. That's something I learned later, but it's something you need to get past if you want to do well in the DATs.
It sounds like one of those scholarship exams from school. In India,
yeah,
right?
Exactly.
Like math scholarship or something like that.
That's the one which takes up most of your time. So for somebody, because math and other things is not much to think. It's just like, if you're traveling at 40 miles an hour and you got to go from point A to point B, which are like 60 miles apart, how long is it going to take? So it's a very easy equation there. But you don't really have to spend too much time thinking about it. That's the distance and that's the speed. So that's the time it's going to take. So it's pretty straightforward, as opposed to, the perceptual ability test is a little more tricky because you have to literally imagine these things. And if you've not done that before, you pretty much consume most of your exam time in that particular section. And then I think there's some sections on chemistry and biology and inorganic, organic chemistry. So again, if you go through their path, there's a specific set of prep materials. So that pretty much covers all of that. That's not too hard.
Good to know that it's not too hard, because people are getting stressed about that.
No.
Suddenly it's like an exam with a lot of math and geometry and stuff like that, and we haven't really touched those subjects for quite some time, right? So yeah.
Correct.
So good to know.
Yeah, it's just that's the reason definitely taking those practice tests with mock tests would help.
Awesome.
It's very similar to your national board. I remember we had a booklet or testlets or something. So it's very similar to the national boards. This one of those extra things.
So how many colleges did you apply to? And how many cycles did you go for?
I should have applied to more. I didn't apply to too many. I think I just asked around, and if all of us we had a few mentors who had done this before.
We had a few number of seniors who were here, right?
Correct. So I typically just spoke to them and be like, hey, how many schools? But I would say, honestly, to somebody apply as many schools, as many programs you're eligible for. Improves your chances. And I should have known that back then, but I did not. But sure, every application fee does cost. Right, that's a problem too. So I would say, unless you have any specific reason that you really don't want to go to a particular school or state, that's the only reason you shouldn't be applying. But if you're actually eligible, I would definitely encourage folks to apply.
For example, I applied to at least 10 schools in the cycle, which I applied for.
Yeah, I applied to maybe 7 or 8, but in hindsight, I know folks who applied later who applied to a lot many more schools.
Yeah, but it's also expensive, right?
As many,
you have to consider what you want to prioritize. Yeah.
Correct, because I know there's an application to cap it, and then there's a supplemental application for each school. So there's a separate for that. So it definitely all adds up. So,
So how did you improve your chances to get into a dental school?
I think your statement of purpose is a very, very big factor. So I would encourage anybody applying, don't Don't have other people write it for you. Don't pay other people to write it. Be honest, do the hard work, write exactly why you're getting in. That's probably the most important part. Uh, that's where a lot of people screw up because nobody really knows you as well as you. Yeah, I mean, your best chances are in you kind of presenting your best side or your side and being honest about it. And no two candidates are the same. No two applications are the same. So they don't have to be the same. And there's and you know, like, think about it. If you're hiring somebody to write it for you, it's never going to be as good as what you could do yourself because you really want to get in. You really want to be in a dental program. So you're gonna do all it takes and put in more effort than somebody who really does not have anything invested in it. You know. So I would say like that statement of purpose is very important. That's big one.
Did you go for any specific extra courses or preceptorships or observations or anything like that?
I did observe. I did shadow in a few offices. Shadowing always helps. I would, if you do have a chance, I would say I would highly encourage folks to do community service if they can. Public health dentistry was very, very important, at least in India, because there's a lot of need. So, I mean, I know like applicants may be in different places, but if you are in whatever country you're in, I would just recommend being part of public health programs is really helpful. So if you a public health program which caters to rural communities where you go out, we used to have those dental vans and we used to go out and do these
from school in villages.
Yeah, all these camps. That gives a unique ability compared to a lot of other other applicants. Once in dental school, I did one to Nepal, which is really cool. But we called it the global outreach program. So these are just different experiences. I mean, if folks want to do research, I think research is always good. Any kind of research experience you can show is always going to be on your side. There may be research, public health, and if you can volunteer in places, if you are able to be part of even a dental school program, that helps. So you can go to a public health department in any dental school and say, hey, like, can I volunteer? Do you need faculty members? The teaching experience is great too. And these are different things which kind of make your application more like more well-rounded application compared.
So we actually went to the same dental school in India and the same dental school in United States, right? So tell me your experience of the NYU School of Dentistry, because people already know about mine.
Well, yeah, I think it was a very hectic program. It was way more hectic than I anticipated it to be. But yeah, the clinics are very hectic. We had way more tests than what I thought we would. Remember, every 2 weeks we were studying for tests.
Friends are like, yeah, we're chilling.
So yeah, it was a very good. In hindsight, though, like when I interview doctor candidates now, I do definitely see that people who graduated from a very hands-on program like NYU are a lot better I shouldn't say a lot better, but they just have got more clinical experience. So I think that's pretty helpful.
Also the fact that our clinics followed a system of comprehensive dentistry rather than departmental dentistry, right? Because when a patient came, we were assigned the patient, and whatever treatment he or she needed, we would do all of that for them, except when they had to go through the master's program or whenever they had to be sent over to the MS people, residents, right?
Good.
So that was in fact almost like a regular clinic where you would have to treat everything for a patient.
Correct. No, I think that's a very good point, and that was the biggest difference for me in terms of a dental program in the U.S. Opposed to dental program in India. You hit the nail on the head there, because it's literally like a comprehensive clinic where you are giving somebody a treatment plan, which starts from the comprehensive oral exam, your cleanings, your basic front checkups, to more complicated stuff like if they need crowns or root canals or they have infected teeth. So you're literally controlling the flow in sitting in one place, as having the patient jump from department to department, because that can get very frustrating for a patient. Because in training in India was slightly different, where we used to do cleanings in one department and then we don't know where
the
they
patient
go.
used to get lost
in
the whole sea of departments. Whereas out here at NYU,
Correct.
we would be like the primary care or the primary dentist for them, and we would direct the patient just in case if they needed to go in some other department. Then we would take them there. Otherwise, most of the treatment would be done
Correct.
by us for the patient, right? And also, we were introduced to a lot of different things like Invisalign. What was your experience with that? Because I know many dental schools don't have that included in the undergrad DDS.
Correct. And I think in dental school, my experience is very limited with Invisalign because it was just literally scraping the tip of the iceberg. But it was still helpful to be certified. So when we got out of dental school, we had the tag that we were certified, but we obviously didn't know enough. So we had to take a lot more of continuing education, which is similar to any aspect of dentistry or any aspect of anything. I guess you start after you graduate, right? When you start taking more and more courses and you continue that education. And that's what we say, right? Our learning never stops. Because Wave 1 definitely was. I'm glad that we were introduced to it, because that's how I do my endos even today. So NYU had very good stuff in terms of what we use. It's very similar to what you use outside of school or outside of a training program. That was the other big difference, because I felt like in India we used to learn a lot more of amalgams and like things we don't really use anymore. I mean, I'm not saying that there's anything right or wrong with it, but it's just, what we learned in New York was a lot closer to what do you apply in practice here, as opposed to it being 20 years behind. My friends who've opened a practice in India, they do all the good things we do, so I'm not saying that they don't. But I felt like the training was a lot more. They achieved a lot of training in those advanced methods, or the way they practiced in school was very, very different from how they practice in their offices. I mean, it's the same here too, but I just feel like things like Wave 1 or the technology we got in dental school. Yeah, no, I think that's wonderful. Yeah, it's always good to be up to date.
Tell us a little bit about the honors program for your implants.
I mean, it was very helpful to know to understand a little more. So we basically we used to have some sessions, both didactic and clinical, with the perio residents, first year perio residents, or it was an international implant class, which was its own entity. So we used to have lectures. I think it was Friday morning lectures. We used to have Friday morning lectures very early. It used to be 7 a.m. to 8 a.m. before clinic. And then we used to go on to clinics. But we had the option to schedule, and I actually placed a few implants there too. So it definitely gives you a little more. I mean, is that going to make you an implant expert? Absolutely not. Correct. Yeah, it just gives you a little more knowledge. I mean, the learning curve in dentistry is very steep, as most people know. So it's not like you do something once or twice and you're going to gain mastery. I mean, we're all still learning, right? I mean, every time I take a class, I understand how little I actually know. So that's the only thing which is in common. But I mean, it's a good way to introduce yourself to a topic and just see if you have any interest or not. If you're interested in it, you can always take more education on it and kind of go from there. And if you feel that it's just something which is not your cup of tea, which happens a lot too, because you might, some people absolutely hate endo and they don't want to do it. And that's awesome when you understand that early on, so you don't have to waste your time doing it, because there's enough in dentistry for you not to do everything, So one way or other, it tells you, hey, like, am I interested in this? Is this something I want to do in the future, or is this something I don't want to do?
Right.
So that was good.
So the other thing was, you mentioned that the school was so hectic, and people ask about, oh, is there time for working part-time jobs and stuff like that? What are your what would you say about that?
There is absolutely no time to work any other job or do anything part-time. I would say focus on dentistry. If you're not doing dentistry, just
it's so tiring.
have a good
Otherwise,
time.
you would get burnt out, right?
Friends, no, exactly. Hang out with friends, get a couple of margaritas. Because I mean, that's the only time. Because once you graduate, you know, like everybody's
I know.
places a week.
It's been
I don't think we've even
like what, 6 years? 6 years since we've spoken face to face like this, right?
Right. So I would just have, like, whoever's doing a program, like, don't stress out about a side hustle or a second job. There's no time, so either like focus on what you got to do to get your diploma, and if not, if you got some extra time, which take some down, enjoy the downtime, just, you know, get that balance at work.
What would you suggest people? Should people actually go for NYU, or should people prefer some other program?
You're adapting to a lot of things, right? It's a new country, it's a new culture, it's a new way of doing things. So 2 years flies past, honestly. 2 years is nothing, right? I mean, that's, honestly, if you think about it in dental terms, it's 4 hygiene visits. That's it. 4 cleaning visits. That's 2 years. So you don't really have the opportunity, especially when you're like running around, you're trying to figure out, and a lot of the international students, I'm sure they're all used to different ways of doing things. So you're drastically changing all of that. So you have to take into perspective. It's not apples to apples, so don't really get held up on that extra year. I don't think it makes a difference. I mean, if you got the option to go into a 2-year program, by all means, go to 2-year program, save yourself some tuition. But if not, I would just, you know, be happy that you're actually there and go ahead and take it. Thinking about what you could have and what you...
That's a great way of saying it, right? So after your international program, tell us your experience with finding a job and all of that.
I think when it comes to finding a job, I mean, I honestly didn't have a bad experience at all. I mean, there was a lot of opportunities. I think one of the things when it comes to finding a job is you have to find what's right for you. So it's important to, I think the most important thing is the values of how you build your beliefs in dentistry, or how you like to practice dentistry. Those core values have to align. And once those align, again, not saying one is good or the other is bad. It's just different people have different values, and you practice your dentistry in different ways. And I would just say, like, it was not hard to find a job at all. There was a lot of opportunities, but again, you got to be prepared to put in that effort. I mean, if you put in a lot of, I'm sure all those who came to this point put in a lot of effort along the way. So I mean, that's never going to change. I mean, you're still going to be putting effort into whatever you do. So just make sure you do your research really well. Talk to people who have worked at a particular office or with a particular company, and see what their experiences are, and see what fits, what fits right for you.
We had a lot of companies come over to NYU for interviewing people and candidates, and
when it comes to recruiting for dental companies, I think they look at certain criteria. I mean, they have the same interest. They want to make sure that somebody's in there for the long term. Because as we just spoke, in 2 years in dentistry is nothing, right? So it's just 400 visits as we spoke. So it's pretty much, you want somebody who, you don't want a dentist who's going to move around every 6 months.
Yeah.
Because 6 months is nothing in terms of dentistry. I'm sure the dental companies who are recruiting, when we go for recruiting events, we kind of look for the same. We want to see if somebody really wants to be here, and what are their criteria, and if we do provide those criteria, and if there's a match, then it makes sense to make them an offer as opposed to a random allotment. Because the last thing we want is provider change. I mean, patients hate it. They don't like to see a doctor every 6 months. It pisses them, right? And nobody wants any pissed patients out here. So I would definitely, Yeah, so I don't know if international graduates are preferred, but I would just say they're probably looking at. I mean, as long as you have a dental license and you, yeah, and obviously, coming out of school, they all know that everybody is rather raw on the experience aspect, but it's more as to their communication skills and what are their beliefs, or do they believe in a team-based approach to dentistry, or that kind of stuff. Can they work well in a team? That's the thing that matters.
Right.
I mean, skills, as I said, skills
Yeah,
can be
that's
taught,
very
attitude
important.
cannot. Okay.
So tell us about your work right now.
I mean, work is fantastic. I work with one of the bigger dental corporates in the US, and I do see my own patients. I have my own schedule Monday to Thursday. Fridays, I'm typically out mentoring a lot of newer doctors who are graduating from a residency program or dental school. I do help them out with recruiting or any sort of mentorship or any sort of other challenges which doctors face.
Where are you located right now?
Well, I'm located in the state of Maryland, very close to DC, 15 minutes from DC, so center of all the action.
How do you like being there?
I mean, it's great so far. I like the East Coast for a number of reasons. It can get tricky during the winters, but it's not as bad as New York or Boston. But it's great. I mean, you got our 4 seasons here. Fall's
awesome.
So it's not a bad place to be.
All right. So, what about work-life balance for you?
I think so important. I know we spoke about it, and I definitely try to ensure that not just myself, but the team, as well as most of the other doctors in my region, have a good work-life balance. So most doctors, I mean, I myself work around 32 to 36 at the most a week, which is very good in terms of balance. So that's what we shoot for. 32 to 36 hours is what most of us shoot for in terms of number of hours you work. Sure, I mean, you have the opportunity to work extra hours if you need to, or a Saturday or any of that, and that's fine. But yeah, I think it's important to have that balance so you don't burn out. It's very, very physical, so it takes a toll on your body.
Well,
So the last thing you want to do is work 60, 70 hours
breaks
and burn out quickly.
to recuperate and get back to it with a zest to work for it, I would say. So, anything else that you might want to add for our interview for our viewers today?
I would just say good luck, and if just make sure that why you want to do what you want to do, that's important. If you know why you are applying for a certain program, and what are your thoughts behind it and feelings behind it, and you stick to it, you should be fine, and you will get there.
Yeah.
Don't pass out.
And enjoy your journey through it.
Take life
It's a long
seriously.
journey. I mean, 2 years pass by,
Correct.
but you won't get to meet your friends very often later on. So enjoy everything.
Plus, who knew something like COVID's gonna happen? So now how to make plans you cannot. So it's crazy. Yeah. Yes, I would definitely tell them not to lose hope. I mean, at times you try once or twice or thrice and you're not there. But I know people who tried 5, 6, 7 times, and as long as you are consistent with your effort, you can't control the results. That's beyond us. But just as long as you do things the right way and you're just focused on it, you should be fine. And again, as we said, don't take life too seriously. Have a good time.
Well, fantastic. That was it was so nice to talk to you, Vipul, and all the information you gave us today was really valuable. Thank you so much for being on this interview.
It's great seeing you as well. It's been a while.
I know, great